Welcome to Third Floor Views, a production of Chesapeake Family Life, where we talk about kids, health, education, and living in Maryland. I'm your host, Janet Jefferson. Today we are discussing vaccines. Here with us is Dr. Turner of Annapolis Pediatrics. Thank you so much, Dr. Turner, for being here with us today.
Thanks for having me.
To our viewers, please feel free to submit any questions that you have in the comment section, and we'll try to get to as many as we can. I know that it can be a hot topic. So Dr. Turner, let's dive in and let's sort of start with some big questions about vaccines. So why are vaccines important?
So vaccines have evolved over the course of medical history as the single most important thing we can do to help prevent disease and save lives. So for us in pediatrics, it has changed the course of children's lives, of child fatality. We save millions of children's lives every day in this country because of the presence of vaccines. So I get a little sort of dorked out over my favorite vaccines. I don't just love vaccines, I have favorite vaccines.
I love it.
Having worked in the intensive care unit during training, you watch kids die from preventable diseases, and you never want to not have a kid vaccinated to the fullest extent. So I am passionate about vaccines.
So vaccines save lives. That's a really big deal.
Yeah.
Can you tell us just a little bit about how vaccines actually work, sort of the science behind it?
So there's a couple of different types of vaccines. Some are live, some are killed vaccines. There's different ways they work, but all of them essentially induce immunity by giving a small piece of whatever disease you're trying to fix, whether it's flu, whether it's measles, whether it's pertussis. You give them a small dose of it, they become, it induces an immune response that then when you're exposed to that same virus in the community, you then already have an immune response, and then you act as if I won't get it because I've already seen it. My body knows what this is, and I won't get the actual disease.
So it's relying on body's natural defenses and sort of tapping into that. So the body sees the whatever it is, and it recognizes it, and it's like, oh yes, okay, now I can fight this.
Yes, exactly.
So one of the things that we've heard a lot about recently, especially with COVID-19, is the concept of herd immunity. Can you speak just a little bit about what is herd immunity and how it works?
Sure. So for each disease, something like measles, for example, once a certain percentage of the population in a community is immune to a disease, not every single member of the community has to be immune or vaccinated in order to not get the disease. So every disease attacks rates in different amounts. So measles is a very, very high attack. And so you need 95% of your community to be immune to measles in order to prevent a single case from happening. Whereas for COVID, the idea is that probably around 55 or 60% of the community has to be immune in order to prevent spread. So when you look at herd immunity, it means that when most people are immune, the whole herd is protected. So every disease has a different number of percent population. So what we've found over time, communities that have high percentage of children unvaccinated or people unvaccinated have sort of gaps in their herd immunity that allow disease to come in and take over. So the measles outbreaks that we saw over the last few years have been pockets of communities that their herd immunity had basically eroded, and there weren't enough people immune to prevent disease spread.
Mm-hmm. Why is it that certain diseases or different diseases have different percentage of herd immunity?
That's a really complicated infectious disease concept that basically is how fast does it spread, and how many people have to have it, and how quickly does it spread. And I will not do a great job of explaining that, other than some diseases are more contagious than others. And measles is one of the most highly contagious diseases we know of. So I use that one specifically. Mm-hmm. Measles is more contagious than COVID, is more contagious than flu.
Mm-hmm. That makes a lot of sense. Who should get a vaccine and why? And then the flip side of that, who shouldn't get a vaccine and why?
I'll start with the who shouldn't get a vaccine. There's very, very few people anywhere that shouldn't get vaccines. There are a few people that have contraindications to vaccines. There are a couple of people who have immune deficiencies or immunosuppressing conditions that prevent them from being able to get things like live virus vaccines. So things like the rotavirus vaccine is a live virus vaccine. If a mom was on Remicade, so a mom might have ulcerative colitis or rheumatoid arthritis and is on a medicine that causes her to be immunosuppressed, it can cause the baby to not be able to get a live virus vaccine in their first 12 months. So there are things like that that you would individually choose not to give a kid, maybe an individual vaccine.
Mhm.
Um, but across the board, there's very, very few contraindications to vaccines. When you look at who should get vaccines, we have a very, very set schedule with the AAP of who should get which vaccines at what ages and what times. There's certainly a little bit of wiggle room, when you get them, but for the most part, we want to give them on the set schedule because we know if we deviate from that schedule, we allow kids to become infected. And even things like if 2 months is when we start giving my favorite vaccines, pertussis and the meningitis vaccines. If you wait and don't give those at 2 months and a baby comes in contact with an older sibling who has pertussis, that kid's not that sick, coughs on a baby, that baby can die because we waited on the vaccine. So we feel very strongly about following the AAP schedule and giving things as soon as we can possibly give them.
So that tells us why we should stick to the schedule. There is a lot of talk out there about, are there too many vaccines being given at once, or can we alter the schedule to maybe be a little bit kinder to the child? Is that a valid statement? Are vaccines still effective if you do alter the vaccine schedule?
The truth of the matter is we actually don't know. So these vaccines are studied, given together on a series. So as my colleague, Dr. Rice often says, we don't want to experiment on kids. So if we give them off schedule or give them separated, we're experimenting on your child because we don't know if they work the same if they're given apart as they are given together. These are all studied in a series, given at a certain time. And that's how we know and we believe in that science. So that's why we give them at the time that they do. So, most kids don't ever get more than 2 or 3 vaccines at a time. This time of year, when we're giving flu, every once in a while there's a kid who gets 4 at a time. And 4 shots does feel terrible. And it feels like, oh, it's just so heartbreaking to give a baby 4 shots. But if you've ever seen a baby in the ICU with lines everywhere and arterial lines and umbilical lines and intubated and scalp IVs, four shots is nothing compared to what happens to a baby in the ICU. What happens when you're, rushed to the hospital via helicopter. So I think it's all about perspective and it's all about looking at what's the worst case scenario. And then God forbid a baby die from a vaccine preventable disease because we chose to hold one. And then in the interim, they got infected with that disease. So it's a little bit why we seem perhaps like we're unwilling or that we're callous about the shots, because 4 shots in one setting, it's the same amount of distress for a baby as 1 shot. They don't feel the difference between 1 versus 4. And the consequences of not giving them all at the same time are so potentially devastating. We can't sleep at night if we worry that we could have done something to save a baby's life.
I think that's really important for parents to remember because parents often, the vast majority of parents have healthy children. And so they experience these shots and think, oh gosh, this is just terrible. But in reality, especially as a doctor you're someone who sees really, really sick kids and you've studied really sick kids and the worst case scenarios. So the idea of that, yes, we can prevent this is really a big deal and it's so easy to do. I think it's really important for parents to remember that in the end, yeah, it might seem a little uncomfortable in the moment, but it's going to make a big difference. And not only for that child, but potentially for another person who maybe isn't able to get a vaccine because they have some reason that they can't, some other disease that prevents them from.
Mhm.
So I think that's critical to remember. And then the other thing that you mentioned, which is as a parent really sort of eye-opening or scary, is that if we change the schedule of the vaccine, so if we try to spread it out, we don't know what that is actually going to do. And so you saying that, oh, we're using your child as a as a test case, as a lab rat. And that would be the choice that me as a parent suggested to you. Oh my gosh, that's crazy. So I think that's also really important for parents to remember of let's take the advice of the medical experts and follow the science, because there's really great science that backs up the power of vaccines.
think that
Um,
it's hard to remember that we are scientists first. I know sometimes it feels like, oh, we work in an office with toys and books and but we went into this because we're scientists and
right.
critically reading articles. And I think COVID has brought out a lot of this
Mm,
where, when you read the newspaper and you see something on Facebook and you're like, oh my goodness, Motrin can't be given. And it's, those are musings of people, not scientific studies. And so we've spent a lot of the last few months reminding people that the New York Times is not a scientific journal and
mm,
that an
mhm,
N of 5 is not a scientific study. And so our job as scientists is to do the hard work for families so that when you come to us and ask us for our opinion, we've gone back to the data, to
mhm,
the raw data, and we've really looked at it and said, this is what the science shows instead of this is what I read in the New York Times today.
mhm,
Yeah.
mhm. Yeah, let's trust the experts, the scientists. Any other vaccine misconceptions or concerns that parents have that you want to just sort of get out of the way and say, you know what, let's make sure we do this or don't do this, or have we
And
pretty much
one
covered
big
it?
thing for flu, right, we're in the
Oh
middle of
yeah.
doing flu vaccines for everyone right now. I got mine yesterday, so I'm very excited to be vaccinated. We hear all the time, oh, I'm not getting the flu vaccine because I get sick every year that I get it. I am, and so that's one we spend enormous amount of energy dispute. It is a killed vaccine. And so you can't possibly get sick. You can't get the flu from a killed vaccine. So
Hmm.
unlike measles or chickenpox, which are live virus vaccines, or even the flu mist, which is a live virus vaccine, they go into your body alive. There's a very, very, very small chance that you could get sick. You could actually get the infection. It's a truncated infection, a mild infection,
Hmm.
but a killed vaccine you cannot get sick from.
Hmm.
So a side effect of vaccines is sometimes you get a little fever, sometimes you get, a little muscle ache or a little sore throat, you feel a little sick. Sometimes you go to a flu clinic where there's 50 people standing around and someone coughs on you and you get a cold around the same time as you got your flu shot, but it's not from the flu shot itself. And then very often kids are always about to get a cold. And so very often it feels like, well, they got their flu shot and then they got a cold. It's just that they were getting a cold anyway. So
Right.
it can be really hard to tease apart what's true and related and what's true and unrelated. So
Hmm.
we really like to remind people you can't get sick from the flu shot. And the consequences of not getting the flu shot are so great that we really want people to remember don't not get it because you think you got sick from it.
Hmm. Hmm. Since we're on the topic of flu, let's talk a little bit more about that. Why is it so important to get the flu shot? I feel like that's something you hear every year, but we don't necessarily remember why it's important. So why do we need to get this flu shot if the flu goes around all the time and it's a common disease and everybody sort of gets it here and there? Why do we need to get this shot?
So flu is sort of one of those terrible viruses that lots of people get and they say, well, it's just flu, it's no big deal.
Right.
But almost every physician in practice has taken care of someone who died from flu, someone who is a perfectly healthy, normal person who now has passed away from flu. And that's something you don't really get over ever. So in this country, about 95,000 people a year die from flu every year. And it kind of floats under the radar and people don't really talk about it. There's a several thousand children die every year from flu. And to me, that's unacceptable. When we have a vaccine that may not prevent every case, it will typically prevent severe flu that leads you to be hospitalized or die from it. I can't, again, sleep at night knowing that people walked out without me telling them, your child could die from this if you don't get it. If people don't want to get it, I can't make them. But at the same time, I would never let my kids go without it. I would never let my family go without it. So how can I treat my patients any different than I would treat my own family?
Hmm.
So I strongly encourage it, maybe to the point of being a little bit of a psycho. I've been accused of that before. But it is one of those scary things that when I have another colleague of mine that the first compression she ever did as a nurse was on a 19-year-old with flu,
Oh my
and
gosh.
you never forget that.
Right.
It's a scarier disease than people think.
Hmm.
Even like chickenpox, people think of chickenpox as being nothing. most of us have taken care of a kid that's died from chickenpox. And you think of that as being just some benign small illness. Oh, yeah, chickenpox party back in the day. A lot of these things are mild illnesses that people recover from fine. But for the people who don't, it's you can never go back and take it back and wish you could have gotten the vaccine.
Well, and it sounds like, let's say you do get the flu vaccine, but you still get the flu. The likelihood that you get a much, much milder version is really, really high. So maybe it doesn't prevent the flu entirely, but it does prevent death, and
Yeah,
that's really
or
important,
better.
right? Why is it so important that we get the flu vaccine this year, with COVID floating around, but so many of us are working from home? So I think an argument would be like, oh, well, I'm not going to see anybody anyways. I'm not going to get the flu. What would you say to that? Why is it important to get the flu vaccine this year?
So one of the things that we follow very closely around this time of year is the Southern Hemisphere's flu numbers.
Hmm.
So it's winter in Australia and Brazil and everywhere in the Southern Hemisphere, flu is floating around right now. And what we're seeing is somewhat encouraging in that they're reporting a 40% drop in the flu cases this year compared to last. So you think, wow, 40% less, but everyone in the world is wearing a mask and is distancing because of COVID.
Right.
So the second thought is, why is it only down 40%? Like,
Right.
these are the things you do to prevent flu. Why is it only down 40%? And
Yeah.
that's again with the presence of vaccine and with plenty of vaccine. There's no shortage of flu vaccine. So I actually am a little concerned that there's 60% of people with flu, despite all of the things that we're doing.
Mhm.
So I think that the answer to that is the reason to get flu vaccine is that people are still going to get the flu. And that is, you can never prevent it entirely. There are kids going to school. There are a lot of kids who are playing sports. There are a lot of kids who are still out. And while COVID doesn't spread as readily in kids, it doesn't appear, at least in the younger kids, kids are the vector for flu. So as soon as the schools shut down, flu season stopped last year, abruptly stopped last year. So kids spread flu very, very effectively. And so what we really do want is for, it's twofold. We don't want kids to get flu because we don't want them to get sick. But flu and COVID at the same time could potentially overwhelm the healthcare system. And we are trying very hard to sort of keep the healthcare system free for whatever COVID spike we may see come winter when everyone moves inside. We also don't know what flu and COVID co-infection looks like. So that's one of the other pieces of unknown. We've not yet had COVID during cold and flu season, and we don't really know what co-infection looks like. That may be a much more severe infection in children than COVID alone. And until we have some experience with that, I'm also unwilling to let kids go with no flu vaccine. I think so for me this year, I'm even more crazy about getting flu vaccine than ever, because what if flu and COVID is severe? What if it's much more significant than flu alone or COVID alone? And I just let you walk out without a flu vaccine saying, it's not that big of a deal. It's just flu. This year, I think we can't take that chance.
Yeah. So right now it's still really hot outside. It doesn't feel like flu season is upon us. When should we, both adults and children, get our flu vaccine?
So, we always say flu before boo is sort of the AAP's recommendation. Get your flu shot before Halloween. Really, realistically, we give flu all the way through March. So we give it until there's no flu left in the state. What we find is that most flu doesn't actually hit the state until January or February most years, but you never know when a year might be December. So we typically want kids vaccinated by Thanksgiving. So for my college kids, I usually make sure that by the time they come home for Thanksgiving, they've had their flu vaccine. So I think there's no urgency to getting it in September. I think another big flu myth is that it's too early to get it. And I think sometimes in older adults, there is some concern about waning immunity. That doesn't really seem to be a thing in younger kids. It's more that the flu bug changes. So by March, it's not the same flu that you got vaccinated for in September. So I think any time between now and Thanksgiving is a perfectly reasonable time to get vaccinated. And I think given, sort of the crush of everyone trying to get vaccinated, there's certainly no risk in waiting until November.
Okay, good to know. Let's transition to COVID-19, and let's sort of really get in the weeds about what you know about this upcoming vaccine. When is it coming? When is it actually going to be available to regular people? And also, when is it going to be available to kids? Sort of just let us know. What do you know about COVID vaccines?
So we are desperately seeking information just like everyone else. And so I'm reading articles all the time, again, not from the New York Times, but from our scientific journals. And a lot of what really is coming out about the vaccines, that what we know is there are 8 current vaccines under investigation in what's called phase 3 trials. So there are 3 phases of investigation when you're licensing a new vaccine. Phase 1 are early just safety vaccine trials, and those are typically done in animals. So phase 3 is the last phase before you sort of license a vaccine and make it available for marketing. So a phase 3 trial isn't really looking at, does this give you a third eyeball? Is this, really dangerous? Like, it's really looking at, does this work better than nothing? So when you
Okay.
look at these are randomized controlled trials, which is a big fancy way of saying the people who give the shots don't know who gets shot and who gets sugar water. The placebo vaccine and the shot are equally distributed, so they get half and half, and no one knows who got what. So there's no bias in, oh, this person got the shot, but this person got the placebo. So when you send people out into the world with these vaccines, the goal is going to be to see who gets sick and who doesn't. One of the things that's going to be interesting, and what they're doing with these phase 3 trials, there's 2 that are quite far in advance. They're giving the shots right now. They're giving them to about 30,000 subjects right now across multiple countries. And they're finishing the first vaccine by the end of September. They will give the second doses because everyone's going to need a second dose a month apart. The second doses will be given in October, and then they will wait to see if people get sick. And then they will compare the people who got the shot with the medicine and the people who got the shot with the sugar water and see, did the shot work better? Did less people with the shot with the medicine get sick than the people with the sugar water?
Mm-hmm.
So when you look at that, you do need to have significant numbers. You can't say, well, 2 people with the shot at the medicine got it and 10 people with the sugar water got it, so I guess it works. That's not enough. We need several hundred people minimum on each side to really prove that the shot is better than placebo. So once those trials are done, that may be several months from the end of October. So I question the idea that we're a month away from having a viable vaccine. And then there are these independent groups that the FDA and the CDC do not evaluate the efficacy of these until they've been evaluated by an independent academic board. That board has no monetary, they're not working for the company. They don't get paid by anyone to look at these studies. So they're very truly independent, so that there's no bias. There's no one there who's going to make money on, oh, I want to push this vaccine out. Mm-hmm. There's nobody who gets anything from it. So I think that's really important. When you're looking at science, you have to make sure, and when we read a study, make sure no one's going to tweak the data to get something out of it. Right. So everything I've read, and actually University of Maryland is where I trained, and the guys there do spectacular vaccine research, and they're one of the sites for one of these trials. So I know these guys, I know these scientists, I know how strong this science is. And worst case scenario, I'll give them a call and say, hey, tell me about this vaccine. Is it as good as you say it is? Mm-hmm. So I think that's one of the best parts about sort of boots on the ground medicine, is that there are people you can call to make sure that this really is as good as people say before we start giving it. Mm-hmm. Now, that being said, these vaccines are being tested in 18-year-olds to 65-year-olds. So once it's licensed, that will be the age range that is allowed to get it. Okay. We most want to give this vaccine to people who are older than 70 because they're the people who are the most severely affected by COVID. So at what point do they do studies in 70-year-olds? Do they just say, well, it's good for 65, we'll give it to 70-year-olds? I'm not sure. I certainly want my parents who are 72 to get the vaccine as soon as it's available. Right. But they have to study it first. Where are kids in all of this? Kids are nowhere in this. So at what point do they do child studies? They're going to have to do child studies before they can license it for kids. And I don't know of anyone who's going to be willing to use it off-label in kids. And they need to manufacture millions and millions of doses, because no matter where the vaccine is made, they're going to be sharing it worldwide. So I think that's another piece, is everyone's talking about the stratification of who's going to get it first once it is ready. Mm-hmm. And that is likely going to be healthcare workers, and older people are going to be the first on the list. Because kids are less severely affected, they're going to be down at the bottom of the list.
So, and this is a big question, and I don't expect you to give me the perfect answer. Everything you just laid out sounds like, oh, that's maybe longer than I was personally anticipating. I feel like there's a lot of talk right now about if, maybe there could be some talk of a vaccine maybe being ready by the beginning of November. And then other people say, no, we're really looking at the winter. But even if that's true, which now after talking to you, that sounds like rather soon, we're still just looking at ages 18 to 65. And then it's only going to be for people in the sort of highest risk categories. So how long do you think it will be until regular families with children will be vaccinated? Are we talking months? Or are we really talking years?
Most of what I've seen has, and again, all of this is speculation because no
Yeah,
one knows. But
absolutely.
probably winter of 2022 is what we're looking at for kids is the very earliest.
Okay.
That even feels optimistic to me. But that would certainly be depends on how fast they can get. I keep going back to look at how hard it was to make masks in
Hmm.
March.
Hmm.
Masks are pretty easy technology. We're talking about making a brand new vaccine that
Right.
a lot of processing, a lot of plant space, a lot of distribution. So I wish I was more optimistic that it's going to be ready by this summer. We'll have all kinds of vaccine. It'll be easily available. And by the fall, we'll be giving it in our own office. But I think there's a lot still to be worked out and a lot of details.
Hmm.
And watching even just testing, where we are with testing right now,
Hmm.
I wish I was more optimistic that it's going to be any minute now. And then I think the other piece too is to remember that this vaccine is not going to be a magic bullet. That this is, I think people are desperately hanging on the hope that if we
Hmm.
just had a vaccine, everything would go back to the way it was in February.
Right. Right.
And I think it's really important to reset people's expectations that that's not going to happen.
Hmm.
That this vaccine, even if it's at 75% effectiveness, which a flu vaccine is typically at about 63% effective.
Hmm.
So even if it's at 75% effective and 50% of the population gets it, which I think is still 45% of people get flu vaccine every year. So those are hugely optimistic numbers.
Okay.
That's still a huge percent of the population that's not covered by the vaccine. So
Right.
I think we're still looking at, we're going to need masks, we're going to need some distancing. Will it get us back to school? Hopefully, yes. Will it get us back to Ravens games? I don't know that we're back to Ravens games with a vaccine yet.
Hmm.
So, are we back to seeing our grandparents? I would hope so.
Hmm.
So I think it's taking just stock of where we're at and what our hopes and expectations are. I think we need to temper our thoughts.
Hmm.
It's not going to be a panacea for all of it. It
Hmm.
will be one tool in our toolbox, and I think masks are going to be with us for a lot longer than we think.
Hmm. That's really helpful to hear. Um,
Disappointing, but realistic.
yes, yes. I think a reality check is good every now and then, even if it might be hard to swallow. One other question about COVID 19 vaccines. So I've heard that, and you even mentioned there are multiple vaccines right now in trial phases. So there are multiple versions of a vaccine. When this finally comes out, if there are multiple versions that are on the market, are some going to be more effective than others? Do people need to shop around? And how would you even go about that? So is that something that regular people are even going to know about? Or is it just like you get what you get and you're just excited to get vaccinated?
That is going to be well, we are going to spend a lot of time working on the science. So we will be deep diving into our contacts, trying to
Mm,
figure out, at this point, I don't even really understand the different science of the different vaccines. I
mhm.
am and only to understand that there is different science, that they're all
Right,
being developed differently.
right.
And so that is all until they're ready, until they're licensed, until we see how they work. I'm not sure that I can even begin to answer that question,
Mhm,
which is a little embarrassing. But I will tell you that's one of those things. That's where we're going to earn our money, because
mhm,
what's going to happen is we're going to go to all of the infectious disease specialists we know, to the health department, to our vaccine developer friends, and say, what do you think? There's huge amounts of resources that we know how to tap. And then average families are going to come to the people they trust. This is why it's so important to have a we talk about patient-centered medical home. Like, you
Mhm.
should have a pediatrician you trust, because you can't go to CVS, to Minute Clinic, and ask them. That's
Right.
not that's not where you're going to go for this type of information. You're
Mhm.
going to you're going to come to your pediatrician and say, hey, you know us best. You know what our kids need. What do you think? What are you giving to your own kids? And we're going to have done the science for you. We'll have done the research for you and give you the options and say, this is what we think is best. And so I think a relationship with your provider, with your doctor, with your own internist, for the parents, that's it. It becomes more and more important as we move into uncharted territories like
Mm.
this.
That's good to know. Well, thank you so much, Dr. Turner, for being here with us today, for answering so many of our questions, my questions, about vaccines in general, and then also the future of COVID-19 vaccine. Also, a big thank you to Annapolis Pediatrics, for being a trusted, amazing resource and being that bridge between parents and the scientific community. So thank you for all the work that you're doing. Um, Thank you also to all of our viewers and listeners for being here with us today. Make sure that you visit ChesapeakeFamily.com for up-to-date local information on home, health, and living for today's Maryland parent. This episode will be archived on ChesapeakeFamily.com in video and podcast format. I'm Janet Jefferson with Chesapeake Family Life and Third Floor Views. Thanks so much.
Thank you.